Hello, my name is Ariana, and I am here to talk about lupus. Lupus is an autoimmune disease that affects your internal organs and your whole body. Lupus is known as a world of mystery, as almost as if it does not want to be found. It hides behind other diseases, for instance, arthritis. You go to the doctor and you talk about swelling and joint pain on any part of your body. This is one of the symptoms of lupus, but they're just trying to pinpoint exactly what it is, but lupus is just does not come to mind yet. So eventually you will go see a rheumatologist, and this is where the trickster gets caught, where lupus can no longer hide. Your rheumatologist will do a blood test result to find out what type of arthritis you may have, but in this test result, they will find more red blood cell count than white blood cell count and a positive ANA result. ANA is labeled as an autoimmune disease, and there is many autoimmune diseases, so now it makes it tricky to find out what type of autoimmune disease you may have. So you go over your symptoms with your rheumatologist, and the symptoms of lupus that can occur is swelling and joint pain, fatigue, random rashes, random fever, foggy minded, and sensitivity to sunlight. So then this is where they will do an antibody test. And in that test result, your rheumatologist will find an anti-dsDNA test result. And this is found in women with lupus. So now that lupus has been found, your doctor will prescribe you medication depending on the severity of lupus, depending on the common and repetitive flare ups you may have, the symptoms you may have. So now that you have this medication, you want to stay on top of it to lessen the likeliness of the flares that can occur. Now, as you hope it didn't get worse, there's actually four types of lupuses. Systematic lupus is the most common lupus found in women, which affects the whole body, including internal organs and swelling of joints and pains, etc. There's also cutaneous lupus, which only causes malar rashes, which causes redness in the face and sensitivity to sunlight. And with lupus and the medication that your rheumatologist prescribes you, being in the sunlight, you have to be careful as the sunlight can cause you to get severely sick. There is also drug induced lupus, which is caused by medication. Now, drug induced lupus is not long lasting, it actually lasts only a short period of time, which just only causes minor symptoms but can eventually go away. But with the most common type of lupus, it is with you for the rest of your life. And there's also neonatal lupus, which affects infants and newborn babies. It's when pregnant women who have lupus and you have flare ups during your pregnancy, especially during labor and delivery, and you have a flare up, you can transmit lupus to your baby. And this is why it's called a high risk pregnancy. And this is why your rheumatologist wants you to be in remission and have a planned pregnancy to prevent flare ups to occur, because your lupus can cause many problems with your little baby's organs that can be very fatal, especially to their little hearts, lungs, and kidneys, the same way as it affects you as a grown adult. It can affect the little baby. There is no cure for lupus. It's going to be with you for the rest of your life, and it's sad that there's no cure, but being on top of your medication can lessen the likeliness of your flare ups. Now, it's known as a world of mystery as it does hide behind diseases, but every disease has its flaws. And being on top of your medication, you can overcome the hurdles that come along with lupus. As a woman who was recently diagnosed with lupus this past year, it really takes a mental and physical toll on your life. It affects your quality of life as fatigue, which is the most common symptom, runs your life. You are just too exhausted to work and do school. That's why being on top of your medication is especially important. Thank you for listening to my informative speech on lupus.